Hey guys, I wanted to revisit a few of the things that we talked about on the first day in the practice. One of the biggest things is, what is chiropractic? A lot of people have been to a handful of different chiropractors and they see that every chiropractor is a little bit different. We like to clarify exactly what chiropractic was built on and designed to be used for. You're going to notice there's no therapies in our practice. There's no, supplements, and those things are great, but we focus on one very specific thing in this practice: your brain, your spinal cord, and your nerves. And that is protected by your vertebrae, which is why chiropractors are so obsessed with the spine, right? But what we know is that your spine must be in alignment to allow this little hole right here to not compress that nerve. Think of all your muscles. If I cut the nerve that goes to the muscle, what happens? It's paralyzed, right? Or if it goes to an organ, the organ's literally paralyzed. It only works as well as the nerve tells it to work. So what we know is when bones shift out of proper alignment, they can compress the nerve. And if they compress the nerve, just the weight of a dime decreases up to 60% of the electricity going through that nerve. Imagine how detrimental this is to your health. This can cause aches and pains, numbness and tingling if it goes to a muscle, or it can cause an organ to simply not work the way that it should. Now we know most cases are neurological at its root, because what can you do? You can do massage, you can do acupuncture, you can sleep it off, you can take medications, you can do surgeries, and what happens? It just keeps coming back. Most organ issues aren't organ issues. They're neurological conditions where the brain can't properly control the organ. We call this the above, down, inside and out philosophy of life. Every single thing in your body happens from above in your brain. Down your spinal cord and out your nerves. Above, down, inside, and out. This is how your body reads. The brain reads the body. This is how your body sends information back to the brain. And if it's disconnected, your body will break down. And over time, it can take up to 10 years to finally get a symptom. So we do advanced diagnostics in our practice. We can do things like palpation, where we can feel to see if the vertebrae are in alignment. We can take digital x-ray to see if there's any chronic issues where the bones are starting to get smaller, which only happens when the bones are stuck. We call that spinal arthritis or degeneration, but it's a sign that you've had a misalignment or a subluxation for decades, potentially 2, 3, or even 4 decades, depending on how extreme the degeneration is. But the great thing is, chiropractic is designed to realign the spine, take pressure off those nerves, restore the communication through those nerves, and ultimately allow your body to heal. Not feel better, heal better. There's a lot of things that can cause pain. So we're not going to treat your symptoms like every other doctor does. We're going to create health within your body, and your body will express health. You will feel as good as you've ever felt, but not just by putting a band-aid over the problem, by actually addressing the thing that causes you to feel great. You're designed to feel great. If you're not feeling good, there's absolutely 100% a reason why, and that's what we're here to address. We're doctors of health, creating health, not sick care. We have a sick care system in America, an outside-in approach, where it's like, take a pill for every ill, right? Every single symptom, you can take medications where there's peer-reviewed research about, if you take this drug, it can decrease your blood pressure, or help your asthma, or your diabetes, or digestive issues, or urinary tract issues, or reproductive issues. But the truth of it is, all of these things come with side effects, which a drug must have a side effect to be backed by the FDA. Why would we just continue to mask it if it's not a last resort or an emergency, when you've exhausted all other options, or you have to for survival? If you're not in that position where it's a last resort or an emergency, neurologically based chiropractic care is the first step to getting your body to truly heal. That's what we're here for. Yes, you must take care of your body. You must put proper nutrients into it. You must hydrate. You must stretch. You must exercise. Your body needs these things. But if your nervous system's not working, it doesn't matter how well you do these other things. It's just a matter of time till it breaks down faster than it should. So there's a few things. So I'm going to see if I can get a chart put up here. We call this the autonomic nervous system. These are all the automatic things in the body that you don't have to think about to make happen. So up top in your neck, you'll see a bunch of nerves here exiting out to your eyes, ears, nose, throat, mouth, right? Your thyroid. When we have misalignments in this area, it can lead to things like blurry vision. It can cause dizziness and vertigo. It can cause sinusitis and allergies, and especially in young kids, ear infections even, and thyroid conditions, right? Misalignments in the mid-back can cause pressure to the nerves that supply the heart, lungs, and stomach. So we're talking things like high blood pressure, low blood pressure, irregular heartbeats, or maybe to the lungs, asthma, emphysema, chronic bronchitis into the stomach, GERD, cramping after meals, and reflux. And absolutely reflux. Even think about the valve on the top of the stomach is supposed to stay tight at all times. Well, what tells it to stay tight? A very specific nerve that branches from the base of your skull. So when that bone gets shifted out of alignment, 95% of births have a cervical misalignment, a neck misalignment. So that can compress the eustachian tube and cause those ear infections, or it can compress that nerve that goes down to the stomach, and it can cause it to get inflamed, and it can cause it to loosen up, and it can cause, colic in our babies or reflux in adults, because then that valve opening, that acid shoots through and burns your esophagus. So you get reflux, right? So we take Tums, but it affects our pH level without ever addressing the thing, why we got the reflux in the first place, right? So reflux is a really big thing that we see every single day. Now, in the low back, misalignments here can compress the nerves that supply our digestive system, urinary tract, and reproductive systems. Now, we got some bigger names here, things like diverticulitis, Crohn's disease, irritable bowel syndrome even, spurts of constipation or diarrhea, right? To the urinary tract, recurring stones and infections, frequency issues even, incontinence, and then to the reproductive system, irregular cycles, heavy flow, early menopausal type symptoms, or even with men, we see a ton of commercials for this. Prostate and erectile issues, right? The brain controls the reproductive system, and when it gets disconnected, a lot of men have a lot of low back pain. A lot of men have a lot of pressure on those nerves down low from heavy physical labor type jobs, playing sports, and that's not just saying women as well, right? But with men, it supplies the rectile tissue. So if that's not being innervated the way that it should, then it's never going to perform the way that it should. And then, you see these testosterone commercials all the time. You see erectile commercials all the time, and the underlying cause is never addressed. So moving away from this, we understand that a lot of your nerves supply your vital organs, but they also supply all your muscles. And that's where all those aches and pains and numbness and tingling can come from. We want you to feel better. We want those aches and pains, numbness and tingling to go away. But we got to get you functioning better. And all the cellular reproduction necessary for you to heal moves through all your vital organs. And the root of it comes from the central nervous system. So we're going to focus in there if that's okay with you. We're going to assess your body in full. The great thing is we have a very advanced technology called Millennial Insight. If you would like to look it up, Millennial Insight technology was used on a couple different NASA launches to measure the effects of space on the nervous system. It's extremely amazing, and it's a huge breakthrough to allow us to see how stress has affected your body. So we can see how well nerves are working. We can see if there's any pressure on the system, and ultimately put together a plan along with our exam and any digital x-ray to put together a specific plan for you to get you back on track, get you back healing, and get your life back. So it's an honor to talk with you today. We hope you enjoy our practice. Again, I'm Dr. Gabriel Long, and I will be talking to you soon.